According to Blue Cross Blue Shield Health Index, they did a little national study, and what they came up with is that there's well more than 70 million Americans who are living with hypertension, or what's also known as high blood pressure. To talk a little bit about it this morning, it is internal medicine specialist Dr. Rosemary Bates on the Wake Up Call. Dr. Bates, hi.
Good morning. Good to be here.
Good to have you with us. So what's your blood pressure, do you know?
You know what? You say that, and this morning, though guilty as charged, don't often check it, is 104 over 60 this morning. Very, very good. I would say uncharacteristically good. So, yeah, very good. But, yeah, we're all walking around with high blood pressure, they say.
All right. What is, when we say high blood pressure or hypertension, they are the same thing, right?
Mm-hmm. They're exactly the same thing. Number one, they're exactly the same thing. Number two is 75 to 85 million people in the United States have it. Number three is most of them don't know. And it's called the silent killer because there's no signs or symptoms of this terrible, this silent killer, if you will.
All right. So if you live with hypertension or high blood pressure for an extended period of time, what is the damage that it does to your body?
So great question. So what pressure actually is the top number or systolic, which we like to be 120 or less, is the pressure when your heart's squeezing, the pressure in your system, if you will, that your blood is exerting on its vessels. And the bottom number, we would like to be 80 or less, is when your heart relaxes. So you think about that. If it's higher, your heart's working harder, your vessels are having a higher pressure in them, getting a little bit thicker, less flexible, all bad. And it's going into your eye, the vessels in your eye and your kidneys and all these things is doing damage there. So a lot of damage, big risk factor for heart attacks, strokes, even diabetes. I mean, just bad. Even a little bit of high blood pressure over a long period of time is a bad thing.
Okay. What causes it?
So, hey, great question. And most of us, so we put it down to either essential or primary high blood pressure, hypertension, or secondary. And most people just have this what we call essential or primary, no cause. Now, there are some risks, like your age. As we get older, it's more likely. Men more than women. African Americans have a higher incidence, and it's often harder to control. Diabetes, overweight, diet too high in salt, immobility, we're very sedentary now. All those are risks. Smoking, too much alcohol. So all those are risks. And, everyday life, I mean, it really is one of those things. And again, unless you go to an eye doctor, unless the dentist often checks it, your doctor, unless you go into one of these stores or what have you and just, I guess, randomly check, you wouldn't necessarily know. So I think those things are really important, especially as we get a little bit older.
Okay. What are the things that you can do to bring it down without going into a regimen of prescription drugs?
Yeah, exactly. So move. I would say move. Actually, we say 150 minutes of sort of moderate activity or 75 minutes of strenuous activity a week. So move. A few pounds in weight. They say even 5 pounds can decrease your blood pressure numbers by a few points. Watch your salt. What does that mean? So we should be eating less than 2,300 milligrams of salt, and most of us are doing more than about 3,500. And if you have high blood pressure, maybe even to get it a little bit lower than that to 1,500. So weight, move, again, the usual suspects. Moderate alcohol, moderate your fast food, avoid diabetes. Again, all of the things that you think of with a healthy lifestyle. And then I would add this, is if it's more than, I would say 130 over 84 or so, and even with lifestyle modification, it hasn't worked. It'd be one of those things I would say, take the pill. I would say that there's many, many choices. I would say you could take a relatively low dose with no side effects, and I think it's that important. I mean, I don't want to go head-to-head with a cardiologist, but I personally would say there's a lot more wiggle room with cholesterol and some of the other conditions. But if you've got high blood pressure, you can't get it down any other way, it's worth taking the pill.
What is that pill, by the way?
So many. You may have heard of ACE inhibitors like the lisinopril and those kinds of things. There's what we call beta blockers. There's calcium channel. There's a little bit of a water pill, a diuretic. So many different ones. And again, I would say you can go on one without any side effects. And not that I want, everybody to be running out there taking drugs, but if you cannot get a good blood pressure with lifestyle modification, I would say it's one of those things that it's a, quote, no-brainer to treat. And again, many different choices of meds, and you should be able to be on one with absolutely no side effects. You really should.
All right. Doc, always a pleasure to have you on the show.
Thank you. You have a great day.
All right, you too. Dr. Rosemary Bates on the Wake Up Call. It is News Radio 1120 KPNW.